So we'll start with x-ray equipment. So in the case of medical x-ray, this is an early x-ray unit, and the fundamentals of the x-ray units haven't changed since these early units. The fundamentals is that x-rays are generated with an x-ray tube. We'll have future lectures which go into more details on this, but at a high level, we're boiling off electrons by heating a filament. Those electrons are hitting a heavy metal, and then out comes an x-ray beam. Those x-rays, we want to think about where those x-rays are in comparison with the visible light that we're really used to seeing around us all the time. So the visible light, the visible range is right here. This is the visible range of photons around us. And then as we go in this direction, we're going to higher energy photons. As we go in this direction, we're going to lower energy photons. And the medical imaging x-rays are right in this range. The medical imaging x-rays are right in this range. So for instance, a common average energy would be 60 kiloelectron volts for the x-rays that are used medically. Again, those x-rays are coming out of the x-ray tube and are then going to pass through the patient. Imagine this is our patient here. So how is the signal level? How do we determine anything about what's going on inside the patient? What we determine, or the way that we have contrast in the signal in the detector, is the x-rays are going to go through the object. They will be incident on that detector or film. And some of the x-rays are going to penetrate all the way through the object and will hit that detector and deposit a signal in that detector. Some of the x-rays are going to go and stop in the patient and deposit their energy relatively locally in the patient. There's also the possibility for scatter, for instance. But for this simple model, we'll just talk about the idea that some are stopped in the patient and some go all the way through. And that's what our contrast is dependent on. So the signal is proportional to the x-ray attenuation times the thickness. So in x-ray imaging, we are imaging and we see everything in that ray path. So all the anatomy is overlapping in what we can call a shadowgram, for instance, as the x-rays pass through that anatomy. So this is a chest x-ray image. So you can see you have the heart, the spine, the ribs, all this anatomy is overlapping. And if we talk about, again, the signal being dependent on that x-ray attenuation times the thickness, we can see that air is going to be dark in these images. So for instance, in the lungs, water will be intermediate, and then bone will be the brightest in these images. That's the fundamentals of how x-ray images are made.